Good evening, all.
Good evening, Hema.
Very good evening to one and all who are there. And we are still waiting for more participants to join. But I'm really happy that today is our 8th webinar of Scintillating Saturday. And that's from the NJH family. So today we have a wonderful speaker. Before we go ahead, I would also like to wish you all a very, very happy new year, because after Diwali, we are all meeting for the first time. Topic, of course, today it is interesting topic. Before we open, I would definitely like to invite, normally it happens so that whenever we open the session, we have always our Vishpala ma'am to welcome everyone. But now today, she is the speaker, and so we have to welcome her. So I would like to invite Dr. Asrani sir. Asrani sir, you all must be knowing, is there since the inception of NJH. He is the senior most party to the NJH family. I always feel that he is the hard task master, and he really keeps all of us on the ground. So, sir would like to share, every time we get a very senior doctors and all, they would like to share their association with NJH, because NJH is totally a different thing. It's an NJH family, and each and everyone they have a very personal experiences with NJH, and that's family. Dr. Asrani is one of the family member. I would say he is I don't know, he must be the eldest family member. So I would like to invite to start with Dr. Asrani sir to please open the session and share his experience with NJH. Dr. Asrani sir, please.
Thank you, Hema. So today I have to talk on I love NJH. If I was 30 years younger, I will show like this. I love NJH. And normally when you tell that I love somebody, you don't have to give reasons. But I'm sure there are several of you who are quite new to NJH. So let me tell you about my association, not only with NJH, but also with the founders of NJH. I'll take you back to 1983. I was just back from Sweden after earning my MD in acupuncture. And I had this brilliant idea of starting a holistic medicine center. I will diagnose using clinical medicine, treat by alternative medicine. So I started looking around where to learn homeopathy. And those days, Subodh Mehta Center was running classes on homeopathy. So in July, I joined a batch, Sunday batch. And that was the time I first time met Dr. Sarla Sunawala, our Vishpala's mother. Very simple lady in white. I was told that she was vice principal of the medical college. And what hit me more than homeopathy was the passion of this lady in teaching. Then we got to know each other more because I had a lot of queries and she had all the answers. I used to meet her in the clinic and I saw her passion. 83, there were no computers, and she would make slides on hand, on paper, hand, color, and then get them photographed and convert to 35 mm slides. Like that much love for teaching, I had never seen. Computers were not in yet, as I told you. Then gradually I decided not to pursue homeopathy because in clinical medicine, we take decisions very fast, and I was told you have to take long history. I think many people are today thankful that I didn't pursue homeopathy. My clinical medicine kept the contact increased. I would get calls from both Sarla Ben and Vishpala, more from Sarla Ben about small clinical queries. about diagnosis, what tests to do, and I always kept helping them. That helped me in two ways. Number one, when you have a senior person who depends on you or trusts your knowledge, then you decide that I can never fail them. So I started updating myself faster and faster. And secondly, this remote consulting, early enough in 1991, I started remote consulting or telephonic consultation, and I started charging. It was late 80s and 90s when Vishpala was managing one journal, homeopathic journal, with Sarla supporting her, that they started asking me queries about whether this article should be published or not because he's claiming this. Is it really possible? And again, another option of seeing their passion in that. Both of them, Vishpala more, Sarla less, because she was involved less, but the passion. And you know, whenever things will not go their way, seeing the frustration in them. So then I suggested, yes, I'm taking credit today of giving the suggestion that if you have so much passion and you both love to work, why not start your own journal? And that idea was taken up, and then we started having brainstorming sessions, and we decided that National Journal of Homeopathy will be born, and how it will be different, because I said we are doing something, we have to do something hatke. So we made two differences. One is that we will have a theme-based journal, and secondly, none of the existing journals incorporated clinical medicine. We will do that because the homeopath today is Hahnemann era. Professor Hahnemann, Master Hahnemann was a MD medicine in clinical medicine. Today, homeopaths has to learn more of clinical medicine. So we will support clinical medicine with homeopathy. And NJH was born in 1992. 3 years into publication, we were still having our teething trouble when the NJH family received a jolt, untimely death of Sarla Bain. Overnight, she passed away. She was absolutely hale and hearty. She had undergone a cataract surgery just the previous week. We crawled, we trotted, but we continued. Not even a single issue was missed. We published, Vishpala published Sarla Bain Memorial, 3 books were published, and we continued. And then, in the cloud of her untimely death, we located a silver lining. The first Sarla Sonawala Memorial Seminar was born in 1995 itself. So 25 years of continuous theme-based seminars. Next one was planned at Aurangabad, but Corona ji had some different ideas. So let me tell you something more, a secret of Vishpala. Largely felt that she wants overall control for everything that she deals with. But let me tell you, she is possessed by homeopathy and NJH. Like, you know, as you say, no, ki, okay, bhoot chad jata hai. She is that kind of possessed by homeopathy and NJH. I would lightly say that homeopathy and NJH ke naam pe unse kuch bhi karwa lo. She makes people do activities which they have never done before. I had never thought of designing covers for journals, but with her prodding, I did covers of over 100 journals, 100 NJH, and then I never did proofreading. I started doing proofreading. I started getting better at that. Today also I don't do covers, but I contribute the byline of the cover. I did proofreading for almost 10 plus years. As Dr. Satish also said the other day that she told him proofreading karoge. All those who are today involved in NJH have learned from grassroots level up. Nobody had these skills beforehand. At times I wonder, you know, this is in a lighter vein, if Vishpala ever sits in Uber and comes to know that the driver is a graduate, she'll ask him, free time mein proofreading karoge. NJH started with a mother-daughter team in 1992, and over 28 years, today there is a huge team of like-minded professionals who are involved in it, as high as 32. So what is the difference between NJH and other journals, you may ask? Most journals are managed by big companies, big corporates, huge organizations, whereas NJH is managed by practicing homeopaths only with a very small supporting administrative staff. Other publications, follow a single school of thought. NJH is not partial to anyone and gives exposure to all thought groups. End of the day, the homeopath who's looking at NJH has to make the patient better. Several major changes have happened over the journey. NJH started with 6 issues a year. Then we said 6 major, 6 small. They were called student editions. Then we said, okay, we are having so much content. Even a small issue used to become a big issue. So we said 12 major issues. Those who have read NJH and those who have not read NJH, I must tell you, NJH issue is like a well laid out buffet at a 5-star hotel. You can get anything that you want there. There is something for everyone there. And pandemic has added several new additions. As we say that NJH is always taking out silver lining from a cloud, the pandemic cloud has given us several appetizers to support our buffet. The appetizers that we launched in the pandemic are webinars, NJH Byte, the newsletter, Tuesday Telegram case, and I am sure before the year is over, Vishpala will bring out something else. Today, NJH, the largest homeopathic content in print and electronic media, an author bank which boasts of over 150 authors, rigid selection of articles, hand-holding of new authors. If you have never published and you want to publish, you send a case, you send an article, and somebody in the team will guide you to make your article perfect and publish it. And 252 theme-based issues. I can go on and on and on, but I think this is more than enough. And maybe another year I will give something more. So with this, I will say that I truly love NJH, and now you know why I love NJH.
Thank you so
So
much.
with this, yeah, I would now like to make the 8th webinar open. The first speaker is Dr. Jagose. Dr. Jagose has been a professor of YMT, Homeopathic Medical College, Navi Mumbai. Those of you today who have a dream of publishing in NJH should get in touch with Dr. Jagose, because he is the person who handholds the new authors and nurtures them till they become very good authors. How to publish, how not to publish is a skill which Dr. Jagose, Vishpala, everybody at NJH team can give you. So friends, thank you very much. Over to Dr. Jagose.
Before Dr. Jagose takes up, I would like to tell a few words. First of all, thank you, Asrani sir, for giving a wonderful explanation of the journey, your journey with NJH. And I think I don't have to work so much because you have shared everything about NJH, about how it has come up, what are the things like NJH Telegram group, Tuesday Telegram group, which we will talk a little later on. Since we have opened the session, I would definitely like to invite Dr. Jagose sir. Jagose sir, brief introduction already has been given by Asrani sir, but sir has been associated again with NJH since the inception of NJH. There is things that sir said that he is a person from Department of Organon, he's guide, MD and PhD guide. But I always felt, because I have also been associated with NJH since years together, but I have hardly, heard him talking many a times. But when I see his presentation and when I see everything, you can the only quote which comes up to my mind is, he is a man of few words. But his action speaks louder than his words. And that's what is apt for Dr. Jagose sir. And that is what is available looking to the awards that he has received. Sir has received Bharat Ratna Madam Theresa Award 2016. Also Bharat Ratna Rajiv Gandhi Award from Jaipur, Tamil Nadu. And of course, he is star of homeopathy. And that's the award he has received in 2019 by London College of Homeopathy. You can see, sir doesn't speak, but sir works. He also has published 2 books, Homeopathic World, which includes history of medicine, and Insight to Tubercular Myasm. I would here like to share with all of you those. I think we have a Tuesday Telegram group wherein more than 800 participants are there, and those who have witnessed Sir's case of tuberculinum, the way he explained everything, and then I think book which he has written, Insight to Tubercular Myasm, beautifully he integrated all the knowledges, materia, organon, repertory, integrated approach that he showed in NJH Telegram group. I would request all of you to join NJH Telegram group because all these stalwarts are available and they are sharing their cases there. Sir, I said, as I said, he is associated since 28 years. He is member of editorial board and published more than 100 articles and 4 articles in peer-reviewed journals. We are going to witness, sir, but you can always go to his YouTube channel, which is Homeopathic Super Session by Dr. Jagose. Excellent YouTube channel. You can upgrade yourself with homeopathy. And today, sir is going to talk on thyroid, which is again, we are coming across day in and day out. But more often than not, we come across with, common presentation of thyroid. Sir is going to present a case where there is a very uncommon presentation and how to deal with such case. And he's also going to focus mainly on case taking, case receiving, case processing, and case management. So let us not waste time and listen to one of the wonderful speaker, Dr. Jagose. I request Dr. Jagose to start with his sharing. Dr. Jagose, please.
Thank you very much, Hema. Thank you, Hema, for the introduction. Good evening, everybody. Welcome to the NJH webinar. It's our 8th webinar today. And today's topic will be hormonal disturbances and thyroid disorders, which may also include PCOS. Well, this topic is taken because in today's world, we are seeing many cases of thyroid disorders as well as of PCOS in our practice. In today's 21st century, people are extremely worried, they are tensed, there's hurry, worry and curry of the normal daily life, not only in daily life, but more at the place of work, where the cutthroat competition of the person in which company is working or with the employee or employer, it makes the body a bit vulnerable to hormonal disturbances. The homeostasis in the body is being disturbed. The internal milieu is in a chaotic state and the hormones they're gone into a toss. As a result of which, the signs and symptoms appear and it may affect any part of the body, but today's topic being PCOS and thyroid disorder.
Your slide, it's not visible. I don't know whether it is visible to all. Only first slide is there still.
Yeah, that's right. That's correct. First slide is only there.
Okay.
Right. Yeah. So I'll be presenting a case of a thyroid disorder and it has a very unusual presentation. And it was because of my keen sense of observation that I was successful in treating this case. So let us see today what this case has in store for us. So basically, whenever we are taking a case, we have to give importance to 3 important pillars in homeopathy. That is case taking, case processing, and case management. So homeopathic practice will revolve around our practical part given in Organon textbook, that is aphorism number 70 to 291. Case taking is from 83 to 104, case processing 146 to 245, and case management, aphorism number 30 to 32, which tells you about susceptibility, 83 to 104 tells you about case taking, 152 tells you about definition of remedy, 153 tells you about the singular characteristic symptoms which are to be taken for the remedy. 245 to 251 deals with posology, and 288 to 291 deals with the auxiliary line of treatment. So let us
All are requested to mute themselves, please.
and here, that is also very important. And it is given in aphorism number 3, that is the knowledges, which you all know. Also in aphorism number 83, where Dr. Hanneman says that in order to be a successful physician, the physician should be an unprejudiced observer, he should be in his sound senses, he should be attention in observing the disorder, and fidelity to a great extent. And in aphorism number 98, he has said that the physician should have circumspection, he should have the knowledge of human nature, he should have patience in conducting the inquiry, or patience to an eminent degree. So these are the qualities which the physician should have. Then you have to be a very, very keen observer. That is very important. He is given in aphorism number 6, that is the unprejudiced observer. So I will go later on into this in detail. And naturally the interview technique, in which Dr. Hanneman has mentioned about how to take an acute case, how to take a chronic case, and how to take an epidemic case. What are the do's and don'ts, and what types of patients they come to the physician, and how the physician should deal with them. So the purpose of case taking is to define therapeutics. So basically, when we are taking the case, we are having a mixed symptoms of what? The common symptoms of the disease and PQRS symptoms of the drug. So our purpose is naturally to see or to identify the simillimum, but also we have to keep in mind the diagnosis of the disease. Then also we come into the personal problems of the patient, whatever life situation the patient has, whatever situation he is going through, a rough time. So it is correctly said that the homeopathic physician is not only a homeopathic physician, but also a friend, guide, and philosopher to the patient. And naturally, lastly, what are we doing? We are individualizing each and every case, and we are prescribing the right remedy. So whom do we individualize? Not only the case, the patient, the drug, and the potency also. So it is correctly said that individualization is the essence of homeopathic prescribing. Now in case processing, we have to diagnose the disease. That is in aphorism number 71, in which Dr. Hanneman says there are 3 points for operation. Number 1, diagnosis of the disease, diagnosis of the remedy, and the case management. Then disease classification has come. In aphorism 72 and 73 is the classification of the acute disease as well as of the chronic disease. In diagnosis of phase, aphorism number 5, he has told you about the exciting cause, the fundamental cause. 72 to 82, he has told you about the acute disease, the chronic diseases. And 173 to 45, he has told you basically about one-sided diseases, internal kind, external kind again subdivided into physical and mental, physical again subdivided into local disease and local maladies, and so on. So out here, you have to see the different phases: acute phase, chronic phase, one-sided phase, intermittent, alternating, etc. In diagnosis of the patient, number 1, the first important is that you have to be an unprejudiced observer. You have to identify whether it belongs to what type of disease, acute or chronic. Then C, in 152, he tells you about the definition of the remedy. 153, he tells you about which symptoms to take: singular, characteristic, uncommon, peculiar symptoms. And in 211 to 230, he tells you about the mental makeup of the patient or the mental disease. Importance given to aphorism number 211, where he tells you about the disposition of the patient. That is very important. If you see the footnote, he has given you some examples about disposition and the drugs. Then about MIASM. So the first introduction of MIASM is given in aphorism number 5, fundamental MIASM for chronic, and acute MIASM for the acute diseases, or the exciting cause for the acute diseases. And again 75 to 82, acute and chronic disease. About susceptibility, aphorism number 30 to 32, diagnosis of remedy, as I told you, 152 to 153, analysis and evaluation, how to analyze the case, how to evaluate the case, what is the remedy response to be seen, what is homeopathic aggravation, what is disease aggravation, what is medicinal aggravation, so on and so forth. And indirectly also about repetization, he has told us. Then the last point is about case management. Out here again, we have to select the correct remedy, as I told you before. Then you have to assess the susceptibility, the potency and the repetition, which is given in 245 to 251. And the general management, including the auxiliary line of treatment, 288 to 291. Criteria for follow-up is already given in the case taking. Then your interpretation and follow-up notes will be also important. So let me present a case to you, a case of a thyroid disorder which had an unusual presentation. And it was because of my keen observation that I was successful in treating this case. The case is as follows. A 25-year-old female came for consultation on 10th January 2003. Well, she was quite all right until 2 years back. She had difficulty in remembering her studies, as a result of which her performance in college deteriorated and she failed twice in a BA exam. Chief complaints were basically she had come with a father, and the father was only telling me the history most of the time, and father was saying that her memory is very poor, especially for recent events. It takes a long time for the patient or for my daughter to comprehend the studies. And even if she studies very hard the full day, the next day she will forget her work. So naturally her concentration was difficult, and since she had failed, she had naturally lost interest in her studies, and she found it very hard to remember her work, but she tries the level best. But unfortunately, she could not succeed in getting good marks or even passing the examinations. Now let us see a little bit more about the case as the case unfolds. In the past history, there was history of measles, pneumonia and worms in childhood. She had done a LASIK operation of both the eyes in 1999. There was delayed talking at the age of 3 years, bedwetting till 9 years of age, and an important point, irregular menses since 2001, had taken homeopathic treatment at Aurangabad with little relief. Family history, father had history of vitiligo, mother irritable bowel syndrome. In the personal history, everything was quite normal, except that she had a craving for salt. She had a marked craving for salt, that is why I put it +4. The father said that she was the only member in the family who asked for more table salt. Not only that, many a times she used to eat plain salt whenever she had the craving to eat salt. So that I also found was very peculiar in the case. Then of course she had a craving for sweets like pudding, pastries and so on, sour things, and she liked the food to be served hot if given a preference. She had a strong aversion to milk, digestion. There was occasionally retrosternal burning after eating, but nothing of great importance. Perspiration marked on soles and nape of neck, and sometimes also on the palms if she was nervous. And there were black delible stains. The menstrual function, it was quite regular, except in the last 2 years, it was irregular, and the flow was reduced, lasting only for 2 days with reddish clotted discharge. Abdominal pain and backache before menses. Thermally, she was a hot patient. She couldn't tolerate the sun. She used to come down with headache. In sleep, everything was normal except salivation during sleep. And she had dreams, but unfortunately, she could not elicit or she could not remember the dreams. On the mental state, there were suppressed emotions. As you go into the life history, it will become clear why the emotions were suppressed. She weeps easily only when she is alone. Anger, she expresses. She is aggravated by consolation. She has anticipatory anxiety, especially during exams. Fear of dogs, cockroaches, and lizards. Basically, she was an introverted personality. She was obstinate, and least contradiction aggravates her. So let us see in the life situation of the patient. The mental state of the patient was probed, and the essence of the case evolved around suppressed emotions. Why? Let us see. Patient was brought up in a middle-class Hindu family. Her father's wish was that her daughter should be highly educated and become something in life. This was against the wishes of the daughter, as she did not want to study any further because she had failed 2 times. And her father forced her to pursue a graduation in the arts degree. and as a result of which there were constant fights between the father and the daughter on the issue of education. Father was very strict and always dictated her daughter what to do and what not to do. He was so strict that rather he was a strict disciplinarian, and whatever he says, the daughter had to follow. Suppose the daughter wanted to go out, the father would say, okay, you come back before 8 in the night. And if she was delayed a big firing, the father is to give the daughter a big firing. So the daughter was under constant stress or was under the constant tension of her father's bad behavior. The constant dominating of her father led to revolt against the father as she wanted a freedom in life. This was not easy as her father reacted in a very negative manner. Therefore, she was aggravated by the least contradiction, and also the consolation given by both the parents also aggravated her. And the mother also could not say much because the father was very, or rather the father was very dominating, and her mother also was keeping quiet. Many a times she used to answer back to her father and then would weep in solitude. She always used to brood regarding her exams and her daily life routine. She was under constant stress of a dominating father, which led her to be very anxious in the day-to-day activities. And this got worse during her examination. Hence, this led to an aggravation of suppressed state of emotions which the patient already existed in childhood. Thus, the core of the case revolves around suppressed emotions. General examination, patient was conscious, she was cooperative, and she was comfortable in the sitting position. Though she was not.
I request all the participants to mute yourself.
Mute yourself. Thank you. Though there was not, though the patient was not saying too much because the father had accompanied the patient. Father was every time telling the history. Temperature was afebrile, pulse 60 beats per minute, radial pulse was taken in the sitting position, probable bradycardia, BP was 120/70 mm of Hg taken on the right upper arm in the sitting position. The eyes had dark circles below both the eyes, tongue was mapped, and the neck, what I observed was the anterior portion of the neck appeared to be slightly swollen, and on palpation, the right side of the thyroid gland was palpable, and the deglutition test was also positive. Systemic examination, it was essentially normal, except in the CNS and the motor system, the reflexes, there was delayed relaxation of both the ankle joints. So, during the full interview, the patient appeared quite quiet and timid and had a sad countenance on the face. She always used to answer either in yes or no to the questions put forth, and only seldomly because the father used to answer most of the questions. And she was fidgeting with a hanky, which was constantly rolling between the palms. And as I told you, for the first interview, she had come with the father, and father being very dominating, didn't allow the daughter to talk, except when I insisted, the daughter only used to answer in yes or no. Hence, only in the first symptoms, rather in the first interview, only a few symptoms were elicited. It was the second time when she came for a follow-up with her mother that the life situation was fully narrated, or it became more clear. So I advised her to get the thyroid levels done, and I had suspected a suspicion of hypothyroidism. So initially placebo was given, and the thyroid reports were awaited. Advised T3, T4, TSH, and reports obtained on 18/1/2003 showed T3 45, T4 3.39, and TSH elevated 34.39. This is the scanned report, which you all can see. Well, I told the patient after seeing her reports and after taking the full case and seeing her symptoms, the general examination, systemic examination, and the biochemical investigations, a conclusion had come that she was suffering from hypothyroid. So naturally, I had given her two choices, either to take homeopathy or to take the modern medicine. But the patient agreed to take homeopathic treatment, and she didn't want to take the modern medicines for the rest of her life. So now let us go into the case processing. So the classification of disease is a dynamic, chronic, fully developed miasmatic disease with characteristic symptoms belonging to the individual type. Or in other words, it is a well-rounded picture of the disease. This I'll explain to you as we go forward. The diagnosis of disease is hypothyroidism, as I told you, because of the symptoms of poor memory and irregular scanty menses, pulse bradycardia, palpable right lobe of thyroid gland, and delayed relaxation of both the ankle joints. Diagnosis of phase is a chronic, fully developed phase. Diagnosis of the person is this what you can see on the screen. You can see clearly later on also. MIASM, dominant MIASM is psychotic. Why? Because she complained of deficient memory, difficulty in concentration, and writing or in remembering her studies. Now, all of you will say that this belongs to the psoric miasm. But please remember that whenever you are identifying any miasm, please see what, or please ask yourself a question: what is the cause behind the miasm? So, the cause behind these symptoms, or rather, what is the cause behind the symptoms? That is the hypothyroid. So hypothyroid comes as a result of the psychotic miasm because of stasis, induration, edema of the face, sluggishness, and so on and so forth. So therefore, though the symptoms belong to the psoric miasm, but the cause behind this is a hypothyroid case or hypothyroidism. Therefore, the miasm becomes psychotic. And the fundamental miasm also is tubercular based on the family and the past history of the patient. It is predominantly tubercular. Now, susceptibility can be diagnosed by a summation of all these symptoms, of all these points. Please remember, only on any one point you cannot diagnose the susceptibility. So what we are learning in theory, like the age, the sex, the occupation, temperament and constitution, etc., that should not be applied in practice. So you have to go accordingly to these points and you have to work out each point, and after working out each point, we come to a conclusion whether the susceptibility is high or low. So let me quickly take you to the case. Symptom exhibited in this case, overall, if you see, there were characteristic symptoms on mental level, physical level, particular level, and also the pathology was well defined. So therefore, we come to a conclusion that the susceptibility is high. So as I said, only on one point we cannot decipher. We have to work out all the points and then come to a conclusion. Nature of the case is a chronic, well-defined case. The symptoms are characteristic, including the pathology. So again, the susceptibility is high. Pathology involved reversible structural changes, therefore it is high. Fundamental miasm tubercular, therefore it is heightened. Sensitivity on the mental and the physical level is high, evident to the symptoms on the mental plane as well as on the physical plane. And history of suppression is absent. It was a fresh case coming. That is why you can see in absence of the suppression, symptoms exhibited are characteristic. And the general condition of the patient was quite good. She was conscious, she was cooperative, PPR, BP was quite all right. So therefore, overall, if you see all these 7 points, we have come to a conclusion that the susceptibility is high. So therefore, the summation of all the previous points tells us that the susceptibility is high. So this is how you have to work out the susceptibility in each and every case. Now, diagnosis of the remedy. As I told you, it was a well-rounded picture of the disease. Hence, it became easy to find the remedy. Why was it well-rounded? Number one, suppression was absent and there were characteristic symptoms at all levels: mental level, physical, general, particular, and the pathology. So the remedy was very easy to find out and it was quite simple. So this was the totality which was taken, and I'm sure all of you must be knowing the remedy by now. It's a very commonly used remedy in homeopathic practice, and it's a polycrest remedy given in our Materia Medica. So the remedy chosen was natrum muriatica. So let us see what some prominent authors have to say about this. So if you read the Catherine Coulter's book in Portraits of Homeopathic Medicine, she beautifully explains the portrait of natrum muriatica. out here, she says the strict father wants to mold the child according to his wishes, leading to suppression of emotions, brooding habit, anxiety, nervousness with perspiration on palms and soles, and the characteristic cravings and aversions are also mentioned with intolerance of heat of sun causing headaches. Our master, Dr. Samuel Hahnemann, in his chronic disease, he has said about sadness, solitude, apprehension about the future, anxiety, peevish and irritability, weakness of memory. Dr. Kent, in his lectures, has said she is extremely forgetful, cannot cast up accounts, is unable to meditate, forget what she was going to say, loses the thread of what she is hearing or reading, there's great prostration of mind, and oversensitive. So therefore now we have to analyze the case. So in this case, the commonly encountered symptoms of hypothyroidism like increased weight, swollen appearance of face, weight gain, etc. wasn't there. Only the mental symptoms were there of difficult memory, which was exhibited or which could be exhibited to the stressful life the patient was undergoing to. So if I wasn't a keen observer and if I did not observe the thyroid swelling or the swelling of the neck region, I would have missed the diagnosis of hypothyroid, and as a result of which I may have been unsuccessful in my practice or in this case. So in the past also, if you see, homeopathic treatment was taken for irregular menses in Aurangabad by a homeopathic physician. So probably that time she could have been in a subclinical hypothyroid state, which the homeopathic physician could have missed out. I'd advised her to do an USG, but she refused. So hence a careful perception of the case led to the right diagnosis of disease, which could resolve the case completely with the similima. Now we have to evaluate the case. So the case represents symptoms which are characteristic on mental level, including different states of the patient during the evolution of life situation of the patient. So as you can see from the life situation, she was very apprehensive. There were suppressed emotions. There was a negative feeling towards the father, and her freedom was curbed. So hence the Kentian method of case taking was taken, or the evaluation was done. Totality was erected, taken into consideration the PQRS mental, physical generals, and the particular symptoms of the patient. Once again, the totality is here, and for your convenience, I had also repertorized the case for you all so that the rubrics taken were mind, ailments from anticipation, brooding, constellation aggravates, contradiction intolerant of, suppressed emotions, weeps when alone, extremities, perspiration, foot, palms, food and drink, milk aversion, salt desire, and desire sour and acid, sweets desire, neck perspiration. So if you repertorize the case, natramute, sulfur, ignitia, lycosepia, calcarea, auroimmune, natronatricum, carcinosin, silicia, phosphorus, and even magnesium comes later on. But unfortunately, I couldn't fit all the remedies. So the first 10 remedies I have given you. So always remember that after that repertory will only give you a list of remedies. The final court of appeal lies in the materia medica. So your knowledge of materia medica will decide out of these 10 remedies which one to take. It is not necessary to take the first 2 or the first 3 remedies. You have to rely on your knowledge of materia medica. So in this case, natramute was taken, and since it covered up all the symptoms of the case. The differential remedies which were on the mind by ignitia, generally ignitia is given in an acute state, maybe also in a chronic state of grief. But out here, they would be marked anticipation, there would be marked anxiety, there would be constant involuntary sighing, there would be a marked contradiction of symptoms, and the patient would be totally non-communicative. In sepia, there would be a depression, indifference, hatred towards those loved best, motion sickness. She would be very creative, she would love sports, and these peculiar cravings of sepia, craving for cheese, nuts, dried fruits, and chocolates. Sepia would like her dark chocolate. So dark chocolate is the favorite craving for sepia. If you get that, then it is quite sure that you're on the right track, provided you have all the other symptoms of sepia and aversion to milk. And in magnesium also, you get mainly a forsaken feeling, timid silent type, fear of loss, and desires meat, sour bread, butter and cheese, aversion to milk, and it has a variety of dreams. So I think so in our Materia Medica, magnesium is the only group which has maximum number of dreams. Dreams of falling in a crevice, falling from a height, sensation of falling, dreams of someone following her, dreams of someone shooting her, frightful dreams, scary dreams, etc. So if you see dreams of magnesium, maximum dreams are there in magnesium because of the suppressed emotions or the repression of emotions which the subconscious mind takes over in sleep, as a result of which excessive dreams are there. And unfortunately, magnesium is not very well represented in the repertoire also. So as I said, susceptibility was high, and since susceptibility is directly proportional to the potency selection, we give a high susceptibility high, so we give a high potency. If it's low, we give a low potency. In this case, it was high, so I would like to go for the higher potency. And the repetition, it depends upon the speed or the ODP of the case, the depth, the pathology, the pace, the intensity, the sensitivity, and the MIASM. Thus, taking into consideration all the above points, it tells us that a judicious repetition may be required. Auxiliary mode of treatment, try to avoid tension and modify her attitude towards the father. I know it is very simple to give this advice, but it becomes difficult in practice because of the situation, tight situation, what she was in. Criteria for follow-up was that the memory should have improved, her menses should have also been regular, or it would be regular. The swelling of the thyroid gland also would be less. And if I would examine again the reflex action of the ankle jerks, it should come back to normal. And also, if I would investigate the patient again by doing T3, T4, TSH, the evidence also of that should be there. Prognosis was favorable because the pathology was reversible and the susceptibility was quite good. So in this case, initially a placebo was given, as I told you, as the totality wasn't clear, and as well as the diagnosis wasn't clear. And after a period of 1 week, the report was available, TSH was 34.39. So Natramur 1M was given, a single dose, followed by a placebo. So gradual improvement was observed in the level of physical generals, followed by improvement of the mental symptoms also. The menstrual cycles slowly showed the regularized cycles. Perspiration on the palms and soles were reduced, and I could see slow, steady improvement of the patient, especially also of the memory. And gradually also the thyroid gland swelling also came down, and the CNS examination was also normal regarding the reflex of the ankle jerks. So after a period of 3 months in April 2003, as you can see, there's a marked improvement. It was first 30, TSH was 34, and now it is 5.74. This is the scan report. Placebo was continued further, and after 5 months, again in September 2003, the reports were taken. Again, it's quite normal. T3 125, T4 5.8, TSH was 6, within the normal limits. This is the report, scan report. And the patient was followed up for 6 more months, during which she was enjoying a good state of health. And it was interesting to note that during the course of treatment, over a period of 1 year, her memory improved to such an extent that she passed her exams with flying colors, much to the joy of the parents, especially the father. So the father was thrilled that after homeopathic treatment, she not only passed the exam, but she did very well, and the father was extremely happy. So one time the father came alone to collect the medicine. So he had asked me that, have you given any medicine, or the medicine what you gave, did it have any effect on the mental makeup of her daughter? Because he had noticed considerable improvement in the daughter's nature towards the father. She had become more understanding. The fights between father and daughter had reduced to a great extent. Her confidence level had improved, and her anticipatory anxiety has practically gone, and she looked very cheerful. So in the following follow-ups, you could see a change in the expressions of her face. Initially, she was sad, she was timid, she was constantly looking down, and now she is happy, she is smiling, she's also talking, and her improvement, her relation with the father had improved drastically. So the case beautifully illustrates the meaning of ideal cure, as in the second aphorism of Organon. The right medicine based on totality of symptoms, but the law of similar alone was enough to pave the way to cure. And the similar alone satisfied the deranged susceptibility by bringing the disturbed internal milieu back to normal, and homeostasis is achieved in the individual. The constitutional remedy was given in high potency as susceptibility was high, which resulted in the stimulation of the psychoneuroendocrine axis, and the cure was achieved. Thus, Kent has rightly said in our medicines act on inner man. That is, if you read Kent's first lecture, The Sick, he has said that our medicines act on they are very powerful, they're dynamized, and they act on the inner man. That is the will and the understanding of the patient. And it brings about important changes in the will and the understanding. So, and I'm again reminding you that Dr. Hahnemann said in FL number 153 that the most striking, singular, uncommon, and peculiar symptoms and signs have to be taken, or they are the solely to be kept in view to select the remedy. Hence, not merely case taking is not important, but also proper understanding is also important, as in FL number 3. So a mere good feeling, patient feeling better, feeling of wellness after administration of similimum is not enough to declare the case is cured. So basically, you can, if the patient is feeling good, and if you do not repeat the biochemical investigations, you cannot declare that I have done justice to the case. Patient is feeling all right, so I think the blood test also would be normal. No, but the evidence should always be there. So the take-home message in today's short case is that one has to learn to be a good observer. For that, you have to read the lesson, The Medical Observer, in Hahnemann's lesser writing, and he clearly says that you have to carefully observe the disease phenomena, pure, correct observation. There are around 2 to 3 pages of this Medical Observer. You please read it. It is very important. You see, I remember a long time back when our senior most member, Dr. Tiwari sir, I had gone for an teachers training program to Dr. Dhavle's Institute, in which sir had taken a lecture on the Medical Observer. It was a very enlightening lecture. So I went home, I read the lecture, and it was extremely important for me, and it was useful also in my practice. So if you read this Medical Observer, he said you have to be unprejudiced. Speculation, overstrained reasoning, false interpretation, and tendency to explain things away must be suppressed. It's beautifully explained there. Each word has a deep meaning. You please go home, open your books and read it. And of course, naturally, you have to examine the patient, both general and systemic, because many a times, people ask us, oh, you're a homeopathic doctor. Do you take temperature? Do you know how to use the stethoscope? Do you all take blood pressure? Do you all examine the patient? Because I believe homeopaths only take a long history and they don't bother to examine the patient. So this is also a wrong concept which is there among the masses. So you have to improve on that. Make a habit to always examine the patient. And of course, focus on the correct perception of the case. This is only possible if you have an unprejudiced mind and do a careful observation. So therefore, you have to immerse the proper totality with ailments from, if available, mental, physical genders, physical particular and pathology, and naturally, it has to be evidence-based. So that's all I would like to tell you about my case. So please, our NJH is given on different social medias like Facebook, Instagram, Telegram, YouTube. We also have a website, njhonline.com and njhonline.in. And we also have a YouTube channel in which all our NJH webinars are kept up within a period of 3 to 4 days. You can just type out National Journal of Homeopathy, search under YouTube, and everything will open up. So before ending, let me just tell you a small little story of how I became associated with NJH. Well, it was way back in 1992. You see, I was working with with many doctors in order to gain experience, because I just passed out in 1989. So I worked with many doctors. One doctor was late Dr. Sorosh Wadia, who I was working with. So that time, I think so his age was around 80 years, and he used to practice, I think so, till he was around 89 or 90 years. So, he had for a seminar, or rather to give a seminar at Nagpur, and his family members resisted because he was very old. So they told him not to go, but he was very insistent. So he told me that why don't you accompany me? So his family members agreed. So I had the privilege of accompanying sir and also attending the seminar at Nagpur in Dr. Kasim sir's Chintamana's seminar of college at Nagpur. We had gone there, and sir had delivered his lecture, and then I saw one beautiful lady distributing pamphlets, which was none other than Dr. Vishwala Madam. And she came to sir, and she was telling sir that I have started my new journal, and she was giving the pamphlet and talking with sir very vibrantly, very bubbly talk was being given to sir. Then sir introduced me that this is my new assistant, Dr. Jagose. So as usual, madam never doesn't leave anybody. She handed over the pamphlet to me, and she insisted that I become a member of NJH. Then I thought to myself, I mean, why do I become a member? Why to become a member? Many people are taking out journals, and and they are closing down. They're not going down for many years. So I was scared that in case I become a member for 1 or 2 years, and if the journal shut down, what would happen to my money that time? So initially I had ignored this, and then once at Masin Hospital, where I'm attached to as a homeopathic doctor, as a OPD, I got an OPD there and attached there in the last 30 years. And that time, Dr. Parina Humronwala was there. She was there in the OPD. And so she told me, why don't you write something for NJH? And that year I had gone to the United States because I got a scholarship to attend a workshop for 7 days at the Maui Academy of Homeopathy at Hawaii. So she said, why don't you write something about this so that people can come to know about what else you have learned or what you have learned in the United States. So she guided me how to write, and that's how I started writing. And then I started subscribing for 1 year, 2 years. And then I was scared to become a life member. I said, let me do 1 or 2 years only subscription. Then I used to attend many seminars. And in one of the seminars, one young girl was constantly looking at me. So I was wondering, why is she looking at me? Then she came up and asked me, excuse me, are you Dr. Jagose? I said, yes. I said, why? I said, I'm sorry, I don't know you. He said, yes, sir, I don't know you, but I have seen your photograph in the National Journal of Homeopathy. And I've also read all your articles. So that's how I have recognized you. I said, okay, so I was so happy that someone recognized me. And in this way, many people started recognizing me from my articles which I've written in the journals. So my personal life as well as professional life has come up with NJH, and I'm practically associated with NJH right from the beginning. One of my sirs, even when I was doing my MD in Beat College, the internal course I was doing for 3 years, my sir, Dr. Ajit Kulkarni sir, who's also a very senior member of our NJH editorial board, he also used to say, hey, Jagose, I've always liked your articles, and I've read your articles in NJH. You have a very you have a very analytical mind, and meticulously solved all the cases. So please keep it up. So this is what encouragement I was getting from different people after I became a member of NJH, and I used to write on a regular basis. So then I decided that I might as well become a life member. So that is more economical in the long term. So NJH has helped me a great lot. It has given me a good platform and good recognition. Thanks to the sailor and our crew of the NJH editorial boards, my students, and my juniors. Constant support and encouragement makes us strive to do better. Well, I also have a YouTube channel named Homeopathy Susceptibility by Dr. Jagose. I'm covering the syllabus of CCH. It will be useful for all the students and those practitioners. If you are update your knowledge, you can also subscribe. Thank you very much. I thank Dr. Vishwala and all the editorial board members and also people behind the screen, even Munira, our manager, who's working behind the screen day in and day out, handling all the subscriptions and everything else for NJH. Thank you very much.
Thank you, sir. Thanks a lot for a wonderful presentation, sir. I think sir tried to cover six major aphorisms. He integrated principles and practice, which is going side by side. And he also focused on the very important aspect, that is evidence-based homeopathy. We may not go with the general feeling that patient is feeling good or better, but you have to go through certain evidences. Wonderful case, sir. In a very short time, I would say you have covered major part of organon, of repertory, and of materia medica, with wonderful differentiation of natrum and sepia and other drugs. I think all, right from the students till the senior most participants, must have been have learned so much from this.